For many people stuck indoors, the shutdown measures can be a major source of frustration. But for those who are immunosuppressed, it could be a life-saving necessity. Doctors warn that people with weakened immune systems are more severely impacted by COVID-19. William Denslow reports from New York.
It's been over a month since Michael Gates left his Brooklyn apartment. After his roommate left to be with her parents in Georgia, he just had his cat Plumpers for company.
He's full of personality, and without him, I think if I were completely on my own, this would be an almost unbearable experience.
About 13 years ago, Gates was diagnosed with the autoimmune disease ankylosing spondylitis. It's a form of arthritis that can cause parts of the spine to fuse. Gates says as the coronavirus first started spreading in New York, he briefly stopped taking his medication because it further weakens his immune system. But rather than jeopardizing his treatment plan, he instead decided to take extra precautions to avoid contracting the coronavirus.
Right now, I can get what I need through delivery services and, just by being careful about what I use, not consuming as much. And so for now, I'm feeling okay with staying inside and, just trying to reduce any exposure even to my neighbors.
Doctors suggest that the millions of Americans with compromised immune systems should self-isolate as much as possible. But many need to leave home for treatment.
Many people that have autoimmune disease need regular doctor's visits. They might have to have diagnostic tests. They may be awaiting a surgical procedure. And for many, their medicines are medicines that are not taken by mouth, but are taken through infusions or injections.
And for the immunocompromised population, everyday errands during this pandemic carry an extra degree of risk. Maintaining safe distancing can be a challenge in New York, especially in the city's grocery stores. Some shops are offering dedicated shopping hours for populations deemed to be at higher risk. As the coronavirus continues to weigh on the US economy, efforts are underway in many states to start getting people back to work. But those at a higher risk may still have some time to go before they can safely stop sheltering in place. Health professionals say reopening without widespread testing and contact tracing risks a surge in new infections.
The analogy is you're going on a football field on a pitch, and you have no idea what the field looks like, and you have no idea where the opponents are. And so if you don't have that in place, you can't figure out who is at most risk and what locations.
Until that changes, healthcare professionals say staying home and maintaining safe distancing is the best way to protect the most vulnerable members of the population. William Denslow, CNA, New York.